7 o'clock hour, and you know the networks all go away at that point. And that is health care, because it's such a critical piece. And it came back to Joe the plumber again, and how Joe the plumber was going to get health care in this small plumbing business that he wanted to create. And each of the candidates has a rather different approach to health care. Whether it's Joe the plumber or any of us, this is an almost universal issue that's going to affect us, whether we're in South Carolina or South Dakota. So would you start with McCain on health care?
And Senator McCain on health care, he definitely believed that we should do more, and what he would like to do is a $5,000 tax credit for families to purchase their own health care, take control of it themselves. When I look at what Senator Obama is talking about, getting the government involved in that process, being a veteran, I look at the VA, which I see as government-sponsored health care, and I'm not happy with it. And I think if we let the government take it over, that it would end up being a bigger VA system, where there's no choice, very limited choices. And I like having the tax credit, but also those that have kids or family members that have chronic, critical health care needs. There is a role the government should play, but I think giving each family that $5,000, competition out there, you can buy that health care across state lines if need be. We need to open it up and get better prices, better competition for those dollars.
Senator Obama's health care proposal has been misdescribed, erroneously described. Senator Obama's health care proposal says, first of all, if you get your health care through your employer, that's fine. You don't have to change a thing. You don't have to change anything. If you do not have health care through your employer, you can join a pool, a very large pool, that will be controlled by the government. Since nobody else supplies it, why not have something like Medicare, or Glenn, something like you and I enjoy from being veterans. Glenn's not 65 yet, but I enjoy both Medicare and military health care. So, you know, I don't shrink from the charge that somehow government health care is bad. But you join one of these large pools, you get lower rates because you're in such a huge pool. You don't exclude people from prior conditions. It is an opportunity to bring millions of new people at relatively low cost into an effective, adequate health care program. Senator McCain charges all the time, and he does it every time. He says that you're going to fine employers if they don't do what you want to do. And he's speaking specifically of small employers. Senator Obama's proposal specifically excludes small businesses. Specifically excludes small businesses. So Joe the plumber ain't going to pay no fine about health care. On the $5,000 tax credit, the only people who will get by as well as they are now with that $5,000 tax credit are young, healthy people. If you are old, like I am, nobody else in this crowd is old, or suffer from some chronic sickness or disease, your family health bill is likely to be $12,000 or more. So you get a $5,000 tax credit, but you pay $12,000 for your health insurance. And where does that come out? And I will just say this about Senator McCain's proposal. The Chamber of Commerce, the United States Chamber of Commerce, has made very critical comments about Senator McCain's program. And the Chamber doesn't make many critical comments about Republicans. It rarely ever says anything good about a Democrat.
But what is the likely cost in those large pools that that Joe the plumber is going to find himself in contrast to the 5,000 that McCain's going to provide as a credit?
Well, if you're young and healthy, $5,000 or maybe even less. If you're old and sick or have some chronic precondition, it's going to range up to $8 to $10,000 to $12,000.
In the pool that you're describing in the Obama plan?
Oh, in the Obama plan, if you admit everybody, regardless of age or precondition, regardless of status of health, it will be something less than $10,000, but I don't know. I don't know the precise figure for that.
Yeah, I don't know the preciseness at all.
Time, as they say, will tell. Time, as we say, is expired for this event. Thank you all very much for being with us for the